Food insecurity has become so much more apparent in our society.
Mhm.
Uh, and I don't recall when I was trained that food insecurity was a pivotal or a linchpin issue associated with stress in children.
Mhm.
But now the research is indicating very clearly that beginning at a very early age, if you go without sufficient food,
Mhm.
um, there are very significant implications for development and emotional health and a family's cohesiveness even. So I'm wondering, in Idaho, um, what do you see from the standpoint of
Mhm.
where this is going?
Yeah, couldn't agree with you more. I think this is really, the understanding has really evolved over the years. In fact, we developed a, a intentional strategy a few years back that we call Hunger to Health,
Hmm.
because you can't separate the two, whether you're talking about physical health or mental health. They're all linked, and have been working with our healthcare partners for a number of years to look at how that connection impacts the lives of individuals and the health of communities as well. And it's a great opportunity to reinforce nutrition as we're providing food to individuals who are struggling to have enough food, that it's not just calories. We need to make sure we're providing the nutritious foods, and also providing the information on how to prepare and feed your family. What's involved in providing a healthy menu and a healthy diet for the whole family. Um, we always hope that people aren't food insecure. If they are, that it's not going to be for very long. But if they are in that place of increased pressure, which leads to increased stress, as we know with the mental health tie, we want to protect their physical health as they're going through those periods of time.
It's become so apparent that the American Psychological Association, the American Academy of
Right.
Pediatrics
Yeah.
are identifying this as a key issue when you come into the office to be able to
Right.
ask. Well, USDA has a two-question
Right.
format now
Right.
rather than a 15-item inventory, so that
Yeah.
awareness in the doctor's office
Hmm.
begins that process of saying, well, if it is a concern,
Yeah.
what could or should we do to alleviate that problem?
Yeah. And such an important partnership that we've seen growing over the years between the healthcare providers and those of us on the front lines and providing that kind of assistance, so that when a patient does reveal that they are struggling
Mm.
with food insecurity, there are resources there in the doctor's office to say, here's where you can go get food in your community. Um, Otherwise, you've identified a problem, but you don't know what to do with that.
It's true, and I think
Yeah.
it's anxiety provoking for the
Hmm.
clinician as well to
Right.
to but to now be aware that there are resources that are satellite resources or
Hmm.
mobile resources for your patients that can
Yeah.
assist with this issue.
Yeah. And we've also had experiences in that in reverse, where we've had healthcare providers who have come to our food distributions and provide some
On site.
information on site,
Oh,
yeah,
I see.
and do some outreach of the importance of, good physical health and mental health, the diabetes management, whatever, A1C testing services that could be provided to, again, just reinforce that there's a connection
Yeah.
here and we need to pay attention to that.
It's so much more than just being hungry.
Yeah.
I mean, the reality here is that we know that 1 in 5 children in Idaho are diagnosable with a mental health condition. And the
Wow.
most prevalent mental health condition is anxiety. And without food, it's pretty clear from the research
Yeah.
that the direct result is elevated stress and
Sure.
anxiety. So
Yeah.
I think that's so important to help us as care providers understand that this is in your ballpark
Right.
and you can be a real contributor to a solution.
Right. And it's also, we've learned over the years that being able to provide that access is really important. If you need food, here's where we have that food. But it's more than that. It's also being able to provide the reassurance that you have community members who care and want to help with
Mhm.
what your needs are. So we're going to take care of the food, but if you need additional um, doctor support, here are some resources. If you need support for your housing costs, here are some resources. So we're really looking at those basic needs that cause the stress that can go beyond food, and how can we help them address those as well.
It's very clear food insecurity plays a role in what's called adverse childhood experiences,
Mm,
ACEs.
right.
And we know that ACEs, if you have much more than three or four, then the implications for you mentally and physically, your risk factors for drug use as an adolescent become much more pronounced.
Right. Yeah. And I think that as we're learning more about those different factors, it reinforces for us that the interventions that we're providing have an impact not just today. It's like, yes, we're going to give you food today, but we want to look at tomorrow, and how do we help move them, the families and the individuals, to a place where they won't need our services any longer. But while they're in that place, how do we help them get the wraparound services that they
Exactly.
need to stay healthy?
Think that is so key to know that as a child, there's someone out there who's going
Right.
to help me or help my mom and dad get food for our family.
Yeah.
And I don't have to worry about it.
Yeah.
The implications for children who are hungry at school are legend. They don't learn well.
Right.
They don't have as good an ability to socialize, and they also struggle with
Yeah.
things like impulse control. And that formula is set up for you as a real problem as you go through school.
Right. Yeah.
It's pretty clear that when you don't have enough food to eat, or perhaps your clothes aren't quite up to speed with your peers, that the
Mhm.
anxiety goes up and the stigma associated with that, and others who perceive you as being in that
Sure.
position create all kinds of difficulties for you. How do you guys assist with that stigma to get people to come to the food bank outlet?
Right. Yeah. And we're certainly very aware of those types of responses and the anxiety that is uh, prevalent in those kinds of situations. So, we talk a lot about respecting the individuals, and always paying attention to how do we make this as comfortable um, as we can. And
Mhm.
so, we try to make the food available in their communities, in locations where it's a safe place. One of the examples is we have pantries in schools across the state. And we find that for many parents who might not feel comfortable going to a public place where people go get food, but if they're seen going into their child's school and walking out with a box, nobody thinks twice
All right.
about that. So we're always looking for those types of ways where we can lower that anxiety or that sense of stigma that might be associated with it. But I'm telling you, the other really important part of that are the volunteers
Mm.
that work at the community level to make the food available in the communities, and they are very aware of different ways that work in their community to reduce that sense of shame or stigma. Where it's a pantry in a church. Again, seeing a family walk into a church, you
All
don't
right.
know that they're going to the pantry. So they have different methods to help mitigate that.
I think that is so clever in some ways to kind of sidestep the natural inclination for folks to wonder what is going on and be suspicious.
Yeah.
And the idea that a community is actually integrated into the outlet, I think is
Yes.
just a champion idea that because they're observing. This
Right.
is this is
They
the real
yeah.
deal. You're
Mhm.
you're you're doing something that makes a difference,
And we hear so many great stories. And we have a backpack program
right?
that is designed for children, school-age children, and we work with a number of partners across the state. Well, we'll provide a bag that's filled with nutritious foods that's enough food for the weekend for the child. And then the teachers identify who those children are who are in need. And then on Friday, before the child goes home, they'll put that bag of food inside the child's backpack in a discreet way.
Mhm.
So, it's not known to others. And they're very careful so that they're protecting that anonymity. And then we have teachers telling us that the kids are so excited on Friday that they'll go skipping down the hall. I got my backpack of food, telling everybody.
Right.
So they don't know.
No stigma
There's
on that.
no stigma. They're
Yeah.
just excited to have the food. Yeah.
Are there programs in the summer for those kids that receive the backpacks during school,
Hmm.
but don't go to school during the summer? What sorts of programs are there?
Yeah, there's a summer feeding program that's actually sponsored nationally and then delivered locally. And so in the state of Idaho, our Department of Education oversees the coordination of the summer food program across the state. And in many areas, the school districts are involved in that. They've got these great kitchens in the schools.
Sitting idle in the
Sitting
summer.
idle, yes. And so many of the districts will keep their kitchens open and they'll provide the food service throughout the summer. The districts that aren't able to do that oftentimes will have a nonprofit partner that will provide the meals and deliver those in the local area during the summer. Idaho does a really good job with our Department of Education in also looking at the rural areas where it's more challenging
Mhm.
because they're not congregating like they are during the school year. So it's more challenging in the rural areas, but we really work as a state really intentionally at how we're going to get those foods available to kids during the summer.
And it gives the townships or the communities the opportunity to really collaborate
Yeah,
with one another or even across
yeah.
townships. We've found that to be true as well with mental health
Hmm.
for children in the schools.
Yeah,
If you put it in the schools, it's accessible and more people use it. And
right.
I really like the fact that the community is participating with the
Mhm.
proliferation of the service.
And I think there's also that reinforcement of the wraparound services because I know we're able to share information about other community services that are available for, mental health services
Right.
or others. When you've got that relationship and connection to the families or to the individuals, they're a little bit more comfortable accepting additional information of
Yeah.
resources.
We have a beautiful state with geographical challenges,
Yeah.
and in terms of the number of resources for mental health, we struggle. We've got good
Yeah.
clinicians, but I think the more they're aware of what food insecurity does
Hmm.
to the progression of health in their therapies, I think it's good for our clinicians to know about it.
Right. Absolutely.